Hey everyone, this is Dr. Todd. I wanted to talk to you today about some health and safety things that we see over at the pet resort. Just kind of want to give you a guide as to what you need to be on the lookout for. Conditions that you see commonly over there are going to be stress diarrhea. You're going to see a GDV, or otherwise known as bloat. And then you're also going to see some signs of heat exhaustion, given the time of year, and also some respiratory problems. So the first one that we want to talk about is going to be stress diarrhea. This is by far and away one of the most common things that we see over at the pet resort. Anytime dogs get stressed out, they are going to exhibit signs of diarrhea. Now, when it starts to be multiple days of diarrhea, or if you're noticing that there's a lot of blood in the diarrhea, obviously that's not normal. So we want to see them over here at the hospital, want to make sure that there's nothing else going on. So if you do notice that, please let someone know. The other thing is going to be GDV. So what happens is when you have these deep-chested dogs, we're talking Dobermans, Great Danes, some Labradors, standard poodles, that kind of thing, we're going to be looking out for dogs that are vomiting. So if they're retching, if they're drinking water and immediately vomiting it back up, if you notice that, they're doing those things, obviously you want to alert someone. Something that you want to do as a preventive measure is make sure after those dogs eat or drink a lot of water, you don't want them to be running around outside or playing with other dogs. You want to give them about 30 minutes before you let them out to do those things. That's going to help prevent the flipping of the stomach that happens after intaking a lot of food or water. That is a very serious and emergent situation. So if you do have an inkling that that could be happening, please alert one of the veterinarians. The other thing that we want to talk about is heat stroke or heat exhaustion, and that's going to be more common in our dogs that have the smushy faces. So we're thinking Boston Terriers, we're thinking Bulldogs, Frenchies, that kind of deal. And when you see those little dogs, we don't want them to be outside when it's 100 degrees, running around like crazy and jumping everywhere. They can get overheated very quickly because they can't exchange air very well through that little smushy face. So if you notice anything, obviously you want to let us know, but first you want to make sure to wet them down and see if you can cool them down. That is something that basically Dr. Johnson likes to use the analogy of an egg. Once an egg has been fried, that's it. It's fried. There's no going back from there. The same happens with heat. If those dogs are out there for too long, sometimes it's difficult to get them back if they do truly have heat stroke. The next thing that we want to talk about is going to be your respiratory issues. So again, the most common thing that we're going to see is going to be kennel cough. Kennel cough is going to be a mixture of a virus and a bacteria. And so once you have that virus in the air, it's going to spread from dog to dog, and it's just going to keep going. It is a vicious cycle. And so even though these dogs are required to have their Bordetella vaccine, there are multiple strains of kennel cough. And so it is conceivable that they can still get kennel cough even when they've had the vaccine. So what we want to do is make sure that we are cleaning very, very well. We want to make sure that all the villas, all of the suites are cleaned, disinfected after every animal goes in there. And if you do know that a dog is coughing or having any issues, please let us know so that hopefully we can get them isolated. But certainly, if you're confused about something, or if you need something, if you have any questions about any of the dog's well-beings, please just make sure to let us know sooner rather than later.